Hello, this is Congresswoman Stacey Plaskett. This month marked an entire year since the United States and the entire world shuttered because of COVID-19. We have come a long way since then, and we are on the road to recovery. While our health providers continue to do their part to keep our community safe and alive, now it is time for us to do our part. We do that by taking our shot, getting our vaccine. In the Virgin Islands, we're fortunate to have enough vaccines to open the process to everyone above the age of 16. When it's your turn, protect yourself and your loved ones by getting vaccinated. The only way we will return to normal again is through the vaccination process. I understand the hesitancy to get vaccinated, from how quickly it was developed to the historic Tuskegee experiment that infected Black men with syphilis, along with the mortality rate of Black women who visited their doctors. All those factors have left many of us traumatized and untrusting. We've also heard egregious claims like the government putting trackers in you or that it changes your DNA. None of that is true. Not only were outstanding Black doctors and scientists involved in the research and development of the vaccine, the National Medical Association, a professional society of African American doctors, formed its own FDA to vet the data and not only endorse the vaccine, but are working hard to urge those of us of African descent to take it. I have been vaccinated, and I wouldn't put my constituents in harm's way. So I urge everyone to thoughtfully consider getting vaccinated when it's your turn. If you have questions, reach out to a physician or a healthcare professional for answers and credible information. Try to connect with someone you know and trust who has received a COVID-19 vaccine and ask them about their experience to help you make an informed decisions. Take your best shot.
Commissioner Justa Encarnacion, who couldn't be able to make it today, and she will be providing us with the latest updates on our response to COVID-19 and where you can get tested for free this week or get the vaccine, which we are encouraging all of you to do. But before we go to Dr. Ellis this afternoon, I want to take a moment to share some really encouraging news, especially for us here in the Virgin Islands, because we were really in a bad place this time last year. If you are like me, you are glued to your TV and what is happening nationally and worldwide with the advent of this coronavirus. The territory has been leading the way towards a new normal. Along this journey, we have experienced minor setbacks here and there, but we have managed to keep the community safe. We were the first in the nation to offer the vaccines to everyone over 16, to all adults, and make it available to everyone in our community. And we continue to provide free COVID-19 screening multiple times weekly to our residents, all at no cost to the public. Just this past week alone, we have tested 3,194 individuals for COVID-19, It's really a good look when you think about last year, we were barely testing 50 people a day. 3,194 a week is almost more than 300 people a day being tested for COVID virus in our territory. And that's how we are winning. So right now, when 14 of the 50 states are at the highest risk for a COVID-19 surge, the U.S. Virgin Islands has a 7-day COVID-19 positivity rate of 1.55%. So right now, when 14 states are looking to go towards their worst, our positivity rate here in the territory is 1.55%. It is the lowest rate of positivity we have seen since our beginning days of this response to the virus. So in over a year now of dealing with this, we are now going back to the lowest point of positivity. This is not only a credit of the great work of the Department of Health, the COVID-19 task force, but it is a credit to you, our Virgin Islanders, who really have been taking this thing seriously and doing the little common sense things to protect yourselves and your families and our entire community against the virus. I just really want to say thank you, a real thank you for making it possible. This is just a glimmer of hope, I know, but more importantly, it's encouraging, it's really encouraging sign that we are headed in the right directions with our efforts to stop the virus here in our community. We are going to bring this thing to a screeching halt. And in order to do that, we have to impose all kinds of restrictions that get on people's last nerves, including mine at some time. But let me tell you, those efforts are being imposed to keep you safe. Last week, we told you that all your good efforts about COVID-19 prevention are being threatened by some people who are coming to the territory and are not committed to the health and the safety of themselves nor our residents. Well, we told you that we were going to start cracking down on people coming into the territory with fake COVID-19 tests. True to our word, last week and this past weekend, we arrested 2 individuals for uploading fraudulent COVID tests to our portal. Now, not just the 2, because more arrests are coming. So if you're traveling, do the right thing. Get yourself a COVID test. Get yourself screened when you go to the States. Make sure when you're uploading a very pristine document that is true, that is not fraudulent, because these types of infractions are felonies. You can also face up to 2 years imprisonment in jail. These are the kind of things that we don't want to do, but we have to do in order to keep our community safe. The other thing I just want to tell you again, if you go out and get the vaccine, within 2 weeks of getting 2-3 weeks of getting your final shot, you're going to have positive antibodies. You go out, you get yourself an antibody test. Once you show positive for antibodies, you're good for 4 months. You can travel up, down, wherever you want to go, east, west, north, south, and you don't have to take another test to get into the territory. So that is a good thing. So encouraging you, if you want to be sure, take the vaccine. I took it since January, no lasting side effects. I'm fine. Everybody else I know is fine. And even Saturday night I was out talking to people, and I usually ask people, have you taken the vaccine? 90% of the people that I encountered in the restaurant had already taken the vaccine. This is the kind of community herd immunity that we have to attain if we're going to beat this and get back to our normal lives. So once again, do not upload fraudulent material. There are not only local charges you face, but there's also federal charge because you're committing fraud across a wire transfer. So without further ado, I want to go to Dr. Ellis and let her tell you what our numbers are looking like this week. Dr. Ellis?
Good afternoon, everyone. As of April 5th, 2021, the Department of Health has conducted 90,048 total tests and detected 2,945 positives. There are currently 62 active cases in the territory, 2,857 cases have recovered, with 26 fatalities related to COVID-19. From our hospitals, Juan F. Louis Hospital and Medical Center reports 3 COVID-19 cases with 1 vented, and Schneider Regional Medical Center reports 2 COVID-19 patients, none of which are vented. Our surveillance efforts continue with our epidemiology hotline. Our hotline is open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. The numbers are 340-712-6299 and 340-776-1519. We are still seeing new cases of COVID-19 across the territory, and everyone needs to practice the same preventive measures that have helped us keep our numbers low in the past. Most importantly, get vaccinated. We are hosting pop-up testing events this week. You can pre-register for the pop-up testing online at covid19usvi.com/testing, or you can also just show up to the pop-up testing. So currently going on right now, St. Thomas Home Depot, it started at 1 to 3. Then St. Thomas Fort Christian parking lot, Thursday, April 8th from 1 to 3. St. Croix, we just finished our pop-up testing for today. It was 10 to 1 p.m. And then Bodo Park on Thursday, April 8th, 10:30 to 1:30 p.m. St. John at the Vipa Gravel Lot, Wednesday, April 7th from 10 to 4 p.m. Also this week is National Public Health Week, and I wanted to share an excerpt from President Biden's proclamation. Quote, "National Public Health Week has increased significance this year as our nation mourns the loss of more than 500,000 lives to COVID-19, and as we have come to recognize just how essential our public health efforts and public health workers truly are, whether it is the scientists and researchers who develop life-saving vaccines in record time, or local leaders who have taken evidence-based action to keep our communities safe, or the staff and volunteers who have worked to slow the spread of the virus through testing, case investigation, and contact tracing, or the doctors, nurses, and clinicians who continue to provide around-the-clock care to those who have fallen ill, dedicated public health professionals on the front lines of our response to COVID-19 deserve our gratitude." During National Public Health Week, we ask everyone to come together to help restore the health of our nation. Every American can do their patriotic duty for their neighbors, their loved ones, and our country by continuing to wear masks as recommended by the Centers for Disease Control and Prevention, practicing physical distancing, getting the COVID-19 vaccine when it is their turn, and by expressing gratitude to public health professionals who are seeing us through this crisis and who are building a more robust, comprehensive, and equitable public health system for all, end quote. On behalf of Commissioner Encarnacion, I want to thank the hardworking individuals who have contributed to our COVID-19 response efforts. It has not been an easy road, but with a dedicated team, we have continued to mitigate the spread of this disease in our territory. I am encouraging you to take advantage of the readily available COVID-19 vaccines offered in the Virgin Islands. So far, 28,933 individuals have at least one dose of the vaccine, and 17,102 individuals are fully vaccinated. We are now receiving Pfizer, Moderna, and the Janssen Johnson & Johnson vaccines in the territory. Our mobile vaccine team has successfully visited homes and seniors in living communities to vaccinate the elderly and those who are homebound. Everyone aged 16 and over is eligible for COVID-19 vaccines, and there are no barriers to getting vaccinated. There are accommodations being made for seniors and individuals with disabilities, and being undocumented should not stop you from seeking the vaccine. If you are interested in scheduling an appointment, please call 777-8227 or visit us online. You can actually schedule your own appointment online at covid19usvi.com/vaccines. There are some activities that fully vaccinated people can begin to resume now in their own homes. People are considered fully vaccinated 2 weeks after their second dose in a 2-dose series, such as Pfizer or Moderna, or 2 weeks after a single-dose vaccine, such as the Johnson & Johnson's Janssen vaccine. The newest restriction to lift for vaccinated individuals is that non-essential travel is now safe. If you travel in the United States, you do not need to get tested before or after travel or self-quarantine after travel. You do need to pay close attention to the situation at your international destination before traveling outside the United States or territories. You do not need to get tested before leaving the US or a US territory unless your destination requires it. You still need to show a negative PCR antigen test result within 3 days or documentation of a positive antibody test result within 4 months for COVID-19 before boarding a flight to the US Virgin Islands. Every time you travel into USVI, you must upload a legitimate test result to the travel portal. Accepted tests, again, are negative antigen or PCR within 3 days of travel and positive antibody within 4 months of travel. A reminder that you must plan your test when you plan your trip. Submission of fraudulent test results and altered test results from a prior testing or altering test results in any way is fraudulent. If your trip is short and you have trouble getting tested each trip, the easiest way to get vaccinated is to test for antibodies shortly after completion of the vaccine series. Visit usviupdate.com for complete travel requirements. To keep up with the latest information, please visit U.S. Virgin Islands Department of Health Facebook page or website at www.covid19usvi.com. And for COVID-19 health information alerts, you can text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis. And I know a lot of those things are hard to remember, right? But if you have Google and you just put Virgin Islands COVID, the Department of Health website is going to be right to the top. It's going to give you all the information you need, whether how many people have been vaccinated, how many people are diagnosed with COVID, how many recovered. All of that is going to be there. It's the easiest thing to remember. If you click on it, it'll take you to the website. All the information is there. I really want to thank you, Dr. Ellis, and the Department of Health for just doing a tremendous job in getting our community this life-saving vaccine. It is really amazing that we have vaccinated over 29,000 people, and of those 29,000, 17,000 are fully vaccinated. I just want to make sure that I really like to put things in perspective in terms of numbers. And when you think about that, we have put 46,000 shots in arms since January. That's 46,000 people that we have actually put a shot in their arm. That's an incredible accomplishment in these few short months. And I thank you, the public, for cooperating. Now, you know, we're not over with COVID. And I want people to understand that, because I know we're doing a really good job, but 2.8 million people, that's nearly 3 million people that have died in the US alone from COVID. Sorry, in the world from COVID. That's the population of the Virgin Islands 30 times. Imagine 30 times the population. This is how serious this virus is, and this is how seriously we have to take it. And, people talk about the vaccine and people coming here and getting the vaccine, and I know a lot of you have that number in your head, but we actually went back and we did the work and we looked through to see how many people who were vaccinated don't have local address. And that number is less than 6% of the total vaccinated people have non-local addresses. That doesn't mean they don't live here. It just means that they put down a non-local address. So I think that's pretty good, and it's even better considering that we have never had a shortage of vaccines. From the time this has started, our numbers keep picking up. And true to the President's word and FEMA, they're giving us all the vaccines that we need in order to make ourselves fully vaccinated and get to that herd immunity. I just want to be really sure and assure you and tell you that it's going to be there. And when Dr. Ellis says we're making it available for everybody, that's me, everybody. So if you're from Dominican Republic, if you're from Haiti or wherever you're from, you don't have your papers, you don't need them. I know that some people are intimidated by going to the vaccine center. They've seen a lot of Army uniforms, which means different things in different countries. But trust me, You're fully safe, no immigration concerns. We just want to make sure that everyone in our community is safe. Because if you get sick, you're going to the same hospital that all the rest of us go to, because there's only one in each of our districts. So I want to thank the community, all of you who have already received your vaccine. If you see me, you know I'm going to ask you, did you get your vaccine? Especially our seniors, we're doing really good there. Please come out and encourage people. Once you get your vaccine, tell somebody about it. Post it on Facebook. Tell people you're okay. Encourage them to get their vaccine. Get your mom, auntie, uncle, grandpa, everybody down there. Let them get that vaccine. We still don't have any lines. You could walk in, but we'd prefer if you call. As a reminder to our residents out there, we know a lot of people still hurting, and we're working to make sure that we get you as much money as possible, as much relief as possible, as quickly as possible. I just want to remind people that rental assistance is available still. We're getting those applications in now. You can apply for those programs. Of course, there are restrictions. You have to show that you had some damage from COVID, or you have to show that you have lost income. And that you're not above a certain income. You can go down there and they will get your rent, not only your rent, but your utilities pays. That's vihfa.gov/ERAP, E-R-A-P. Or just call them, 772-4432 or 777-4432. Make sure you get that. I know a lot of you out there have been getting checks. It's amazing. I was in a grocery store, and for the first time, people weren't asking me for where is their tax check. And we're getting them out to you and getting them out as quickly as possible. But we're also working on your stimulus payment. We know we had a filing date on March 15th, that after that date, you couldn't get your stimulus payment. We're still honored those people who had submitted after that date. We're trying to get those tax returns in and get you your checks out. So we still have about 3,000 more to do, but 3,000 checks are going out this week. Those are the $600 checks. So we're going to continue to give that out. And then the $1,400 stimulus that was approved, we still haven't gotten the money yet. We haven't gotten the money. We haven't gotten the rules. You know that the territories are always attended to last, so we're still waiting for that. We have the listings already, so as soon as we get that money, we're going to start sending that out to you as well, so we can give you that assistance. So that's the other $1,400 check that should be coming from Treasury. But we can't go forward if we don't have money and we don't have rules. So bear with us and the federal government as they mire through this. Remember, the administrations are changing, so there's a lot of things going on in DC. We're not as fortunate as the states. We have to send out our tax check. They send out their tax checks and their stimulus checks for them. So we continue to bring in as much federal resources as possible. We thank the delegate for all the work that she's doing up there to make sure we're getting that money out into the streets. If you didn't get your stimulus last year, remember, you can file for it on your taxes. So when you file your taxes, there's going to be a box there that says, "Did you get your stimulus?" If you didn't get it, you're going to they're going to reissue you that money in your tax return. So all is not lost. So if you didn't get the first one, you can file for that. That was I think the first one was about $2,000 thereabouts. If you didn't get a check, you filed too late or whatever, you can still collect that too if you put it on your tax collection. And thanks to President Joe Biden, our tax checks are going to go out even faster now that we have the earned income tax credit being reimbursed to us through the federal government. We're hoping that we get this out as quickly as possible. Last week, we issued 6,424 income tax returns. That was about $15.7 million. So we want to make sure we keep the money coming because we know people out there struggling. One request, spend local. Our businesses need your business as well. The Bureau still has their hotline in place. That's 714-9325. Now, two things I hear when I go out on the road. I hear about tax checks, stimulus checks, but I also hear about the roads. In the state of the territory this year, I told you we're going to send down $20 million for the legislature to decide where we're going to put this road paving projects. In that, I wanted to make sure that we're making an effort to do some things that need to be done in our community. One of them is the Nardo Drive. We have an agreement with the Hartmans for that property as well as the library, and we committed to building that road. We need to complete it. To our people in Hall Bay, we want to make sure that we have that boat ramp repaired as well as other boat ramps. As you can see, our marine economy is blowing up. So we've always said that we wanted to do things that were going to make the community better for every one of you. That's the infrastructure projects and roads, roads, roads. You always remind people, when we came into office, there weren't even traffic lights up in some places. So we've seen tremendous progress, but a lot more work to be done. And every day as you go out and you traverse the roads, you're seeing new things done, things being built, things being dug up, things being demolished, because we are on the job working it. But this $20 million is going down to the legislature. We put in some things in there that had to be done, like Nardo Drive, ease that traffic around Fort Milena, the Hall Bay project. But we also suggested a lot of other things for the Senate to pick from, because these are not random projects. These are projects that have already been designed and are ready to go. We know that there are a lot more projects out there that need to be done, but this is not the last tranche of money that will be coming to the Virgin Islands. So we put in, we suggested that they complete places in St. Croix like Lorraine, St. George's, Bugby Hole, Upper Love, Wim, Campo Rico, Union Mount Washington, Calcahoon, St. John, Strawberry Hill, Richmond, in St. Croix, and in St. Thomas and St. John, we wanted to make sure that we cover places like Miskunce, Luckland, Estate Hope, Frenchman's Bay Road, Mandel, Marion Hoy, Lilliandale, Smith Bay, Foss Avenue Road, Hospital Ground, Estate Carolina, and Center Line Road. So there's a whole bunch of roads in there. There's a lot of money in there to do them as well too. We made sure that we gave each island a piece of what's going on, trying to get these roads cranked out as quickly as possible. It's just part of our administration's, real push for tight infrastructure. Lots of projects going on, and we want to make sure that we work with Senate President Donna Fred Gregory and her whole team down there at the legislature to get some of this stuff done. Before I leave, I want to also mention and invite you to learn about all of our administration's effort to invest in our people. Our workforce development is a big piece of that. Paying back your tax returns is a piece of that, the 8%. Putting money and resources back in our people is a priority of this administration. This particular conference, we're going to be talking about our youth summer experience, some of the things we're doing around apprenticeship, some of the things that we want to do to put over 500 Virgin Islanders to work. Mostly young people, but not exclusively young people, getting them out in work experiences in different industry. This is going to be live. It's going to be on Facebook. You'll be able to see this virtual town hall tomorrow at tomorrow the 7th at 6 p.m. So tune in for that. Of course, my favorite LT, Tregenza Roach, will be there, give a little comments. But we also have some other special guests, like the Commissioner Malloy of Labor. We also have been making a special appearance, Adamo and Pressure and Tia. So it's going to be a really good appearance. You're going to hear from some of the young people who have done well in the Virgin Islands, give their take on what workforce development looks like. Also will be there and will be hosted is Rashidi Clements. So it's going to be on Government House Facebook page. Please tune in and get that. It'll also be on Labor's Facebook page. I'm sure if you're on social media, you'll see a lot of that. Please tell your young people to tune in so they can hear how they can connect to our investment in our people. I also want to, before I go, I was out in Magens Bay this Easter weekend, and I saw the boats rafting up, and I just want to give a shout out to my commissioner and the DPNR team that went out there and kind of straightened that out. But what I want to really talk about is, we are a growing territory. We have a lot of problems. I mean, every single day, there's a long list of problems for me and the team to get ahead of. But the one thing that I'm going to always say is that with any progress of any people, nation, country, wherever, there are going to be problems that come with it. Yes, we have a marine opportunity. But that marine opportunity also comes with challenges. But we're doing the things, and you have to trust a little bit in the government, that we're doing the things to make sure that, yes, we too are concerned with Magens Bay and the amount of boats are in the other harbors, whether it be Benner Bay, Cruz Bay, Coral Bay, or Frederiksted. But we do have to take a moment and acknowledge what an incredible marine experience, how we have reinvigorated the blue economy by doing one simple thing, by being open and kind to boaters. It's not an accident. We strategically made the move to welcome boaters from all over the Caribbean and the world during a time of COVID. And they feel welcome here. That's a good thing. Now we have to do the things like find you, the captain out there, to help maneuver these waters through DP&R, find people to join the police force, people to fix boat engines and repair sails and help with the charters, people to book people and get them on these charters and service these boats while they're here. That is an opportunity. Are we going to have problems in that growth? Yes. I'm here to tell you, Virgin Islanders, we are on the precipice of incredible growth in this territory. So we have to be prepared with all of the pain that's going to come with it. The construction that's going to be in the streets, the new people that are going to be walking our roads, the children that will be born and will start to go to our schools, and yes, the sick that will come to our hospital. We have been before this before in the 70s, and that is the way that we have this beautiful Virgin Islands today. People came from all over, but this time, between this administration, Tregenza Roach and I, and all of the people that work for us, we will have a coordinated approach that will have better outcomes. So our 2040 plan, it's not a flighty thing. It's an organized plan that recognizes that the incredible growth that we have to pursue will be mixed with problems. Not problems that we can't overcome, but opportunities that we have to take our young people and train them to take advantage of. I just want you to work with us as we see this through. We're going to get there. So be positive. Let's talk about the good things that's happening in the community and attack the bad ones with all the vigor that we can in solution, not complaining. I want to thank you all for joining us today. God bless you. Love you. Are we taking questions? We don't have any questions. Have a fantastic week.